So first thing, both these cases, I understand, are in people under 25, and one had traveled recently, one had not, other than going to neighboring New York. Any insights we can glean from these two cases?
So, I mean, I think there's still a lot we're learning about this new variant. The epidemiology showed that it was first identified in England. Now it's suggesting that it spread, throughout the world. So, whether or not these cases were directly tied to England or may have been acquired more locally, I think we still have a lot to learn.
And these two cases identified based on sampling. Not everyone who tests positive is tested to see if it's this new variant. So the point is there could be a lot more than two cases of this very virulent strain here in Connecticut right now, right?
So that's an important point. Not every sample that's tested gets tested with what we call genomic sequencing. So that's that deeper level of genetic information that we have on these strains. A sample are sent to reference labs. Here in Connecticut, the Jackson Lab and Yale are participating in some of that genomic sequencing. So I think we're going to learn more and hopefully expand our capacity to do this kind of sequencing to learn more about this virus in Connecticut and throughout the country.
And of course, we don't want to be overly optimistic or pessimistic about this. We want to be realistic about this. From what we know about this so far, there's not a reason necessarily to believe that this new strain is more deadly in itself, but there is the potential for more death because of the potential for exponential spread, correct?
Yeah, exactly. So what we know about this this particular variant is that it spreads more. It's more transmissible, so it spreads a little bit more easily. And that was what was seen in England, where it became kind of the dominant strain of COVID-19 that was circulating. What we don't have evidence for is that it causes more severe disease, so it doesn't necessarily cause more likelihood for hospitalization. And importantly, we don't have any evidence that the vaccine would be ineffective against this. So that's really an important piece of information. We're going to learn more both about the epidemiology, the way this variant spreads, but also more about the scientific basis of it, and understand what that's going to mean in terms of our prevention and treatment strategies.
Yeah, I had heard that there was a reason to be optimistic about the vaccine, and there's no difference in the way this is treated either. Once you have it, the treatment protocols are the same as well, right?
So that's right. We use the same types of treatments, the antiviral therapies, the dexamethasone for our sick patients. The vaccine as well, should be effective against the strain based on, our understanding what we're seeing. It's something we have to keep monitoring on. There's the one therapy that we have to be careful with is the monoclonal antibodies. That's something that we have to look at very carefully. Right now, there isn't evidence that they're not effective, but that's something that when we see new variants, we have to be particularly attentive to. But in general, in terms of the vaccine and our other therapies, they should be equally effective against this variant.
And what it means to all of us right now is that we should double down on safety protocols. Because this spreads more easily, that just means, as Governor Lamont said earlier today, we just have to be more careful.
That's the critical message. At this point, this virus seems to spread in the same manner as, other variants of COVID-19, of SARS-CoV-2 spread. And, that's really important. So the same preventive strategies, the masks, the distancing, the attentiveness to ventilation, those kinds of things still are very much applicable. And in fact, just like you mentioned, even more reason to double down on those when we're dealing with a virus that may be more infectious, more transmissible.
All right, Dr. David Banach of UConn Health. Once again, we appreciate your time, and good luck to you and all your colleagues in the healthcare community and all of us, really.
Thank you for having me on.
All right, bye now.